Hi friends, welcome to my YouTube channel Future Midwife. Till my last video, I have explained you the content which happened before pregnancy. So today onwards, I have a plan to take topic which is related to pregnancy. So today we will see about diagnosis of pregnancy. Pregnancy is a condition of carrying developing fetus inside the uterus. It is a physiological state, but the confirmation of pregnancy is very important. Usually women, they experience some sort of signs and symptoms. That means some kind of physical changes she can experience once she is pregnant. Still, the confirmation, that means the diagnosis of pregnancy is very important by a gynecologist. The initial steps in the diagnosis of pregnancy contain identification, that means the calculation of gestational age. So that start from the first day of last menstrual period. Usually we abbreviated it as LMP. The total duration of pregnancy include 280 days. That means 40 weeks, or otherwise we can call it as 9 months plus 7 days. So as I said you, the total duration of pregnancy, that means the 280 days can be divided into 3. First trimester, second trimester and third trimester. The first trimester includes 0 to 12 weeks. The second trimester includes 13 to 28 weeks. The third trimester includes 29 to 40 weeks. The anatomical and physiological changes occurring during pregnancy are responsible for the signs and symptoms. So these signs and symptoms can help to identify, or we can confirm whether the woman is pregnant or not. These signs and symptoms can be classified into 3. The first one is subjective sign, and second one is probable signs, and the last one is positive signs of pregnancy. So here we can see the subjective evidence of pregnancy. This subjective evidence of pregnancy is a group of signs and symptoms. So we'll see one by one what all are the symptoms and what all are the signs. So first we'll see about the symptoms. The symptoms include amenorrhea, morning sickness, frequency of menstruation, feeling tired, breast discomfort, quickening, abnormal appetite. So whereas the sign include breast changes, skin changes, Jackmer's sign or Chadwick's sign and Osiander's sign. So we'll see one by one. The cessation of menstruation, that means amenorrhea. So usually we call it as missed periods. This can be happen due to increased estrogen and progesterone production by the corpus luteum. Slight bleeding at the expected time of menstruation rarely occurs in the first 3 months. So that's we called as Hartmann's sign or placental sign. So should not get confused with as threatened abortion. The second one is morning sickness. Usually 50% of cases we can see the morning sickness. Usually appears soon following the missed period. Nausea, vomiting, especially in the morning on rising from the bed. Usually disappears after the 3rd month. Third one is frequency of menstruation. Due to congestion of bladder mucosa, irritation of the bladder by the pregnant uterus. Resting of bulky uterus on the bladder can lead to anteverted position of the uterus. Change in the maternal osmoregulation can lead to increased thirst and polyuria. These changes usually disappears after the 3rd month. Fourth one is breast symptoms. There are enlargement, heaviness, discomfort and pricking sensation. So usually it's seen 6 to 8 weeks of pregnancy. So usually it can be seen in primi gravida. The fifth one is appetite changes. So usually the craving of certain types of food and refusal of other types of foods are common during pregnancy. The sixth one is fatigue. The frequent symptom that may occur in pregnancy and which has a tendency to sleep always. Next is the probable signs of pregnancy. In that, First one is breast signs. So usually this breast signs will be prominent in primigravida. There are few changes which happen in the breast. In that first one is enlargement of the breast, as well as there is a visibility of breast veins. The second one is presence of Montgomery's tubercles. That means the appearance of sebaceous gland. So the third one is expression of the colostrum, and the last one is presence of primary and secondary areola. Next is the skin changes. There are few skin changes can be happen during pregnancy. These are chloasma, stria gravidarum and linea nigra. Chloasma is a dark brownish patches on the skin. Usually it is seen in the forehead, upper cheeks, lips and nose of pregnant woman. Next is linea nigra. It is a dark line which is visible in the abdomen of the pregnant woman. It extends from the belly bottom to the pubic area. Next one is stria gravidarum. These are the strias or dark color strias can be seen over the abdomen of the woman. Usually this stria gravidarum can be happen due to the extension of the skin due to gravid uterus. So here we can see the pelvic changes. So there are three types of signs will be seen in pelvic changes. That are Giacomo sign, Osiander sign and Goodell sign. So we'll see one by one. The first one is Giacomo sign. This Giacomo sign is otherwise called as Chadwick sign. It is dusky hue of vestibules and anterior vaginal wall visible at about 8th week of pregnancy. The discoloration is due to local vascular congestion. The next one is OCR sign. Apart from this bluish discoloration of the anterior vaginal wall, walls become softened, copious, and amount of non-irritating mucoid discharge appears at 6th week. There is increased pulsation felt through the lateral fornix at 8 weeks called Osiander sign. Next one is Goodell sign. In that, cervix becomes soft as early as 6th week. The pregnant cervix feel like lip of mouth, while in non-pregnant state like tip of nose. Apart from these signs, we can feel other two types of sign during pregnancy. That is Hega sign. It is present in 2/3 of cases. It can be demonstrated between 6 to 10 weeks. It is softening and compressibility of the lower segment of the uterus felt on bimanual examination. The other sign is Palmer sign. That is irregular rhythmic uterine contraction on bimanual examination at 4 to 8 weeks. Probable signs of pregnancy include detection of HCG in urine and blood. It can be detected by two ways: immunoassay without radioisotope and immunoassay with radioisotope. The immunoassay without radioisotope include agglutination inhibition test, direct agglutination test, ELISA test, immunofluorometric assay. Whereas immunoassay with radioisotope include radioimmunoassay, immunoradiometric assay and radioreceptor assay. So last is the positive signs of pregnancy, which include palpation of the fetal parts and perception of active fetal movement by 20 weeks of gestation. Auscultation of the fetal heart sound in between 18 to 20 weeks. Fetal cardiac action by Doppler equipments by 10th weeks of gestation onwards. Ultrasonic recognition of pregnancy. So here the white gestational ring by 5th week we can identify. Also fetal pole and yolk sac by 6th weeks. Cardiac pulsation visible at 7th week. Embryonic movement at 8th weeks. Here we can wind up our today's video. In this video, I have explained in a simple way the diagnosis of pregnancy. So next class, we will meet with another episode of midwifery topic. Till that, take care. Bye bye.